All right, ladies and gentlemen. Singapore is a country that has done very, very well containing the coronavirus. In fact, I would say like right now they're like the model. Them, maybe Korea, who had it very, very rough. Um, I really would like you to hear what he has to say about social distancing because I find this guy to be a very reasonable person. And the way he talks about how it should be rolled out and what the importance of it being rolled out correctly are.
Have to now shift our approach. We will still maintain some basic surveillance at the borders, including using swab tests for travelers who come in who are febrile or who have respiratory symptoms. But we will have to double down on the measures we can do within Singapore, and we will look at the whole range of social distancing measures. We have already started social distancing because if you look at measures like isolating patients, putting close contacts on quarantine, issuing stay-home notices, these are social distancing measures which we have already started.
Okay, just we are there too. We have started that. Quarantining and self-isolation has been in play for a while. So how he talks about the next steps being rolled out, I think are very reasonable, and they come from a very calm, well thought out point of view.
Over time, we will have to ramp up and do more social distancing measures. Today, we are announcing something
Sorry.
with regard to the suspension of senior activities. Going forward, we will look at the fuller range of social distancing measures we can put in place, including for public events, community activities, school closures, workplace, social distancing, including.
Please do not leave class and say, Mr. Galenda said school is going to be canceled. I am not saying that. I am saying that that is something that is being discussed. And this man has suggested it possibly for his country. And if we were to do work from online, we are very prepared to handle that. Look at how we're working today.
Including things like staggered hours, telecommuting, as well as religious services too. So we will cover a broad spectrum and we will see what we should put in place. We are very mindful that these measures can be very disruptive to the lives of Singaporeans. If we were to do all of them at one time, we will literally have to shut down our city and everything will grind to a halt. If you were to start some of them too early, people may become fatigued and then you cannot sustain the measures and then it will not be effective either. So getting the measures right and applying at the right time is critical. And in that context, it is useful to think of these broad suite of social distancing measures as something we can apply from time to time as circuit breakers throughout the entire epidemic cycle. And by doing so, we put in brakes to try and stop the transmission chain or slow down the transmission chain and flatten the epidemic curve. So that should be our thinking around social distancing. And
so there he is again. He's talking about flattening that epidemic curve instead of that large bell curve that we peaked at right here, where it went up. Sorry, got some popping up. Where it went up really high above the capacity hospitals. We want to try to use social distancing, correct hygiene, self-isolation when sick, quarantine when exposed, to round it off and keep the level very, very low as we can, as to not overtax our healthcare system.